Hello everyone, I am Dr. Parthsarathi, Senior Consultant Surgical Gastroenterology and Minimal Access Surgery at KIMS Hospital, Minister Road, Secunderabad. So today what we are trying to do is to collect and address some of the most common fears and doubts which our patients have at the time of discharge after they undergo a hernia operation, and we try to give answers to those questions. Let us see those questions. Almost all patients ask this question, should I be in bed rest, or they assume that they have to be in bed rest, and if yes, how many days should I be in complete bed rest after a hernia operation? So this is a myth that after any major operation one has to be in complete bed rest and should not move out of the bed. It's a myth and it does more harm. Bed rest actually does more harm than good to the patients. In fact, we strive very hard to achieve early mobilization of patients. Even on the same day of surgery, we make the patients get out of bed, get them walking. So what advantage this has is, when the patient starts walking, his breathing improves, the blood flow from the legs start flowing to the heart, and thereby the chance of any blood clot developing in the lower limbs, which is called as deep vein thrombosis, is less. The patient's intestines start functioning earlier, their appetite is returned earlier, and also it gives a lot of psychological strength to the patient to be able to recover faster. So one advice which I always tell my patients is, you do not need absolute bed rest. Of course, they should not be doing any strenuous exercise, but all patients after hernia operation, be it laparoscopic or open, should be encouraged to get out of bed as much as possible and move around. Absolute bed rest is no longer recommended for hernia operations. We give adequate pain relief in the form of painkillers when the patients go home, so that should take care of the pain factor, and they should encourage themselves to get out of bed and be on the move, and thereby they actually shorten their recovery time.